So good morning, everyone. Thank you for joining us on behalf of Guyana Trans United. It's my pleasure to welcome you and to acknowledge in this event for International Transgender Day of Visibility, which is actually tomorrow, to acknowledge the work of Guyana Trans United and all of our Caribbean transgender citizens, and to bring them into this space, even if they could not be here in person. So we invoke all our transgender citizens and all our transgender ancestors who have been criminalized and brutalized as part of our Caribbean and colonial history. I would like to, first of all, welcome Candace McEwen of Guyana Trans United to share a few welcome remarks. Candace?
Good morning, Vidya. Thanks for hosting this event for us this morning. It is very important that we keep, even though that we celebrate Trans Visibility Day and acknowledging the work that trans person would have been able to do and courageous stand up for the years in terms of visibility. It is important that we continue to keep the work doing, continue to have space that we could able to have our voice and after other conversation. I want to thank each and every one of our panel this morning who is going to be presenting. I also want to thank each and every one on our participation list this morning who participating. And we want as much as question to be asked and as much information should be given. So this conversation could be as much as fruitful as possible. Thanks very much.
Thank you very much, Candace. So in terms of our format for the conversation today, we first of all have a panel presentation of about 20 minutes from the researchers. And then we have an item, hopefully, yes, I think Raven Gill from Butterfly Trans Barbados, this was us who will reflect on the research that was done. And then we will have time for discussions, and then we invite Guyana Trans United to give some closing remarks. So it's my pleasure, of course, to introduce the panel now. Dr. Jill Thomas is a private research consultant with a background in clinical social work. Her recent academic collaborations have focused on sexual prejudice and transphobia in the Anglophone Caribbean and violence against college women in the United States. Dr. Ariane Harvey is an internal medicine consultant and clinical lecturer in the Faculty of Medical Sciences at the University of the West Indies. Dr. Harvey studied medicine at the University of the West Indies and completed her postgraduate training at Yale University. Her academic interests are medical education and in non-communicable disease management, particularly in the context of gender disparity. Dr. Michael Campbell is a senior lecturer in behavioral science, clinical psychology in the Faculty of Medical Sciences and chair of the HIV and AIDS Response Program at the University of the West Indies, Cape Hill, Barbados. He's additionally appointed as a lecturer in psychiatry at the Yale School of Medicine. It's my pleasure to hand over to the panel now. Timothy.
Thank you, Vidya. Go ahead, Dr. Campbell. So, Dr. Campbell, I think you're muted.
Yes, I am. I'm not. I am just looking to share the screen here. There we go. Sorry.
Grateful if people can keep themselves muted during the discussion.
Sorry about the technical issue. It's not showing me the right screen to share for some reason. Let me
It's the green share screen button at the center.
No, that is not the issue. It's just not showing me. It's showing me everything else on my desktop except for the actual presentation that I want to. Let's try this.
Okay.
And let's see if this that might work. Hopefully you're seeing the first slide of a PowerPoint presentation.
Yes, we can see it.
Very good. Apologies for that. So good morning, everybody, and thank you very much on behalf of Dr. Harvey, Dr. Gromer, and the rest of our team, some of whom could not be here, for inviting us today. So we already had some brief introductions, so I will just mention that our colleagues who have supported this research, who had other commitments today, are Dr. Maisha Emanuel, who is a psychiatrist at Cave Hill, Dr. Natalie Graves, and Dr. Heather Harewood, who are both lecturers in public health and experts in qualitative research. And Dr. Majumdar is our director of medical education and has not only been supportive of our research, but will be a key person as we move forward thinking about expanding and augmenting transgender curriculum in medicine in Barbados. So why did we do this, undertake this research in the first place? And I realize that we are presenting to an audience that is quite well aware of some of the good reasons to pursue this research in the Caribbean, but the bullets here are from a PAHO report on transgender health in the Caribbean region, and they identified the issues that you see here, right? The disproportionately high levels of exposure to violence, including deadly violence, the high levels of psychological distress, often correlated with environmental with external causes like employment discrimination, disproportionate burden of STDs, HIV, and other STIs, relatively high levels of substance and alcohol use, and the issues surrounding negative health outcomes from self-administered hormones and other medications. So it turns out that we are not the first researchers to make this a priority area. Nastasia Rambaran, who, by the way, some of you may know her, she is a graduate of University of Guyana and a public health physician. So Rambaran and Granfell did a paper in 2016 identifying knowledge deficits and deficits in training and experience supporting LGBTQI+, we probably should have put healthcare, among primary care doctors in Barbados. So this paper was partly about transgender specialty medicine, but really more about the general primary healthcare environment for LGBT people. And as you might imagine, they identified deficits in training, which, you know, could be addressed proactively earlier on in medical education. And so the implications of provider attitudes, as well as actual training and experience for transgender healthcare, are an area that needs attention. So we're going to talk very briefly today about findings from two studies, one of which I think was included in the announcement for the talk today, and that is a quantitative paper looking at attitudes towards transgender people among medical students at Cave Hill, and more precisely among 205 medical students enrolled at Cave Hill in 2018 and 2019. We asked our students to complete an instrument called the Transgender Attitudes and Beliefs Scale, the TABS. So the TABS is an instrument that was developed in the States, but we were interested in its performance in the Caribbean, partly because it has solid support for its use in terms of the psychometric properties, but also because, interestingly, the researchers who did the initial validation study made sure to include people with conservative faith-based beliefs. They were mostly evangelical Christians in the US, but we thought that the coverage of conservative religious beliefs had some relevance to the Caribbean, so it was a good candidate for us to try. I also wanted to add that I think it's important to note that our campus is probably the most international medical campus in the UE system. So we have about equal numbers of Barbadian and Trinidadian students, and also a significant contingent from Bahamas in each entering class, and as well as students from OECS and Guyana as well. So we didn't actually break down by nationality here, but I think that our student population has some more generalizability to the broader Caribbean than some other campuses might. So the TABS has 3 component scales, and they make some intuitive sense. The first scale is interpersonal comfort, which is essentially how comfortable people would be spending time with a transgender person, hanging out, right? You can see I'd feel comfortable having a transgender person into my home for a meal. The second scale is more has more to do with specific beliefs about sex and gender, some of which actually are potentially more right or wrong answer questions as opposed to attitudinal questions. But you can see an example there, right? There's all humanity is only male or female. There's nothing in between. And the third scale, human value, has more to do with individual worth and dignity of people. Right? Transgender individuals should be treated with the same respect and dignity as any other person. So, oops, wait, there we go. That's the right slide. So this slide summarizes our results. The first bullet is probably more of interest to psychologists and measurement people, but what this means is that the overall scale and the individual subscales actually performed pretty well in our Caribbean student population. And the confirmatory factor analysis suggested that actually those 3 component scales that the developers, alleged exist actually bear out when we look at the data in Barbados. That is to say that the pattern of responses in our students suggests that these 3 dimensions are important aspects in attitudes towards transgender. And we found some results that were both surprising and not so much. So surprisingly, there were no gender differences among our students in overall attitudes towards transgender people. That's the total score on the scale. And that is unusual because a number of previous studies in different parts of the world have suggested that women tend to be more accepting and have more positive attitudes, but those findings aren't universal, and they weren't here. However, women did report higher interpersonal comfort scores. So women were more comfortable in terms of actually spending time or interacting with transgender people. It was also somewhat surprising the scores weren't correlated with age or year in medical school. Now, because these are undergraduate medical students, there's a restriction of range effect on age. So it's possible that, if we had a broader range of ages participating in the study, that we would have found some differences. But the year in medical school finding is a little more surprising, because we might anticipate, in fact, we might hope that as students progress in medicine, that they would develop more informed and positive attitudes towards, diverse groups of patients generally, but we did not find that. The other really interesting finding, I think, for us is that there was a ceiling effect for human value. And what that means is basically all the students endorsed very robustly and enthusiastically the human value of transgender people, right? And in fact, they did that to a greater extent than positive responses on the other scales. And in fact, the human value dimension seemed to operate somewhat independently, in the sense that it didn't correlate with beliefs on the other two scales. And that suggests that students may have variable kind of attitudes and comfort levels, but when you ask them what is in some ways a more abstract question about, do people have human value and should they be treated with dignity, they are quite eager to endorse that. But the actual, the more specific attitudes regarding transgender and beliefs about the nature of transgender may be a different issue. So the second study, which has not been published yet, has been submitted for publication, was a follow-up that we did with the support of Butterfly Barbados and the United Nations Development Program, and particularly Raven Gill, who is here today. And that study was a qualitative work consisting of focus groups in which our colleagues, our medical educator colleagues, participated. So the educators were curriculum leaders in clinical medicine with, as you can see, with a very broad range of experience. So several themes emerged from the focus groups. The overarching theme was pragmatism, which is to say that if we are to move forward with integrating and developing transgender curriculum at Cave Hill, that we need to do so in practical ways that take into account resource and time limitations and so forth. So under that umbrella, our colleagues talked about knowledge gaps, about transgender people in healthcare. So when we say knowledge gaps, what we mean is that they, in some cases, probably did not have as much knowledge or experience as they would like, but in other cases, they perceived that they were less qualified to integrate that content. So when they were talking, actually, we noticed that they did have a reasonable amount of knowledge about some key issues in transgender health, especially for the undergraduate level, right, for integrating teaching, but they perceive that they weren't very confident, competent, or comfortable, right, teaching in that area. And certainly there were also tensions in terms of time and resources available, because our curriculum already is quite full. And there was also discussion of what kind of content and where to put it in the curriculum, which ties back to the issue about pragmatism. Where, where does this fit best and how can we do it in our existing structure? And also our colleagues certainly did acknowledge the environment of stigma and discrimination and particular barriers to quality healthcare for transgender people. And there was acknowledgement that, that medical education plays a role in setting the culture of the health system. So we have a slide on state of curriculum. I don't know, Ariane, would you like to talk about our curriculum since you are teaching in clinical medicine, or would you like me to talk about it?
Sure, absolutely, Mike, I can. Good morning, everybody. Again, thank you for allowing me to participate. So yes, I'm more on the teaching end of things, certainly with respect to both what we call phase one of our preclinical years, which is more didactic lectures and more introduction to the underlying theory that underpins medicine. And then I am a clinician lecturer formally, so I do a lot more patient bedside management and teaching with students there. So in terms of our state of curriculum at Cave Hill and UE, our preclinical years, transgender education is kind of a small but formal part of the general introduction to ethics in dealing with a diverse patient population. So minority and underserved populations, it kind of gets roped under all of that in the preclinical years, just in terms of introducing an approach to ethics. And then in the clinical years, it's usually encountered more informally in the clerkships. So as students rotate through the core clerkships and then subspecialties as well. We do have more formal covering in Barbados with help from Butterfly Barbados in psychiatry and medical ethics and humanities, which is a clerkship in itself. So that's, I think, probably our most formal representation of teaching in clinical years. And then we do see a kind of smattering through specialties where you would have more interaction with transgender issues in terms of from a medical care standpoint. So you'll see focus more in endocrinology, obviously genitourinary health, child and adolescent health as well, plastic reconstructive surgery, dermatology and aesthetics, psychiatry, and infectious diseases, as Mike alluded to with respect to the disparity of burden for STIs and particularly HIV care. In terms of assessment, which we know as, teachers, that assessment drives learning, I will say it's not generally included in formal assessment specifically. And that's something that we're quite interested in looking at for future. But that's kind of the general state of our curriculum as it stands in Cave Hill. And I don't know if you might want to advance the slide. Or
yes,
stay a little more on Butterfly Barbados as well, if you want to. Okay. Very good.
So I think this is our last slide, which I think all three of us could speak to. And this is a segue to discussion, because I think we would rather talk with you rather than at you. But there are a number of implications for this research, both for future research agendas and positive change in curriculum. So we are thinking about how to leverage research findings for impact on faculty and university culture, and in how we treat our students, both in terms of medical training, but also how we treat our transgender students more generally in terms of campus climate and climate in medicine in particular. So we are thinking about issues of inclusivity and modeling of representation. And we are thinking also specifically about curriculum and teaching. So general etiquette, what we mean by general etiquette is trans affirming and trans welcoming medical practice across all specialties, starting with primary care in public and private settings, right? So this is about decreasing barriers of access to healthcare broadly for medicine. And we are thinking about incorporating more effectively, and additionally from what we've started into clinical teaching of transgender content. And I think this last point is going to be a little more challenging, but specialty specific training is important. So as some of our students advance towards specialties in medicine, what do they need to know in internal medicine, right? Or psychiatry, right? Or dermatology, right? And because some of that training becomes more, specific specialized clinical training and may have, more direct impact on transgender medicine as a specialty in and of itself. So we'd be very interested, I suppose, including Guyana, in exploring attitudes in other medical education settings and actually practice settings as well. We've already had some conversations informally with the new nursing postgraduate program in Barbados, and the coordinator of that program is interested in nursing attitudes, which, by the way, as many of you know, are really important because in a lot of settings, patients spend a lot more time with nurses than doctors, right? So nurses do a lot to set the culture of healthcare institutions. Ambulance and paramedics, right, is another area. I don't think anybody has looked at this in the Caribbean, but it would be an interesting area in times of crisis and emergency, right? How, what are the attitudes and what are the actual practices of care? And finally, as I think we said before, curriculum reform. So we're thinking about teaching in medical school. And because we have not historically had the level of teaching we would want, we are thinking and actively discussing trying to develop continuing medical education content in transgender medicine for practicing physicians. And I think that's it. That is it. Jill, would you like to add something, or we can segue into a discussion?
Oh, I am really most interested in hearing what the other participants have to say. I think you've really covered, it pretty well, but I'll be happy to field any questions too.
Okay, thank you very much to everyone on the panel for that succinct presentation of very important work. And already there's some comments in the chat. So what we're going to do before, first of all, again, to welcome those of you who've just joined on behalf of Guyana Trans United, and in acknowledging too persons in the room who are here. Transgender Day of Visibility 2022 will be commemorated tomorrow, and acknowledging all transgender activists who are in the room from Guyana and other parts of the Caribbean. So, and thanking you for your work and your presence. And the panel had referred to the work of Butterfly Trans Barbados in the qualitative work. And I wonder if Raven Gill, who I think Raven is in the room, we had asked if Raven would like to just speak for a few minutes about what it was like participating and initiating that research on behalf of the trans community. Raven, are you there?
Hi, good morning. Sorry, I'm late.
That's all right, it's good. We can hear you. All right, thanks. Yeah.
Great. So, good morning, everyone. My name is Raven Gill. I'm the founder of Trans Barbados. That's the only transgender focused civil society organization in Barbados. And our mission and vision is to create a change needed for transgender persons in Barbados regarding the access to mental health care, access to general health care, access to education, spaces, wherever there is that that's what Butterfly is currently working on. Our partnership with the University of the West Indies was mainly, like in the presentation said, to find the attitude towards trans inclusive care in the curriculum. And I thought it was interesting that seemingly no other Caribbean country, my knowledge at the time, has done anything so bold, because that is and general health care practitioners to provide the necessary resources that we can transition safely. So in partnering with the university, it was definitely a great step because the work that has been done in this short space of time has definitely got a lot more recognition and solidified our opinion in what we can and cannot do as our next step in the future. So we're grateful to Dr. Campbell and Dr. Hart, Dr. Schmack for recognizing and thank you for giving us the work on this project so quickly. And definitely the need for it was that the level of stigmatization that we face regarding our gender identity as living as communities. And I think that going forward, we have a lot more work to do and are definitely looking to partner with other charities, CFOs, and get our therapeutic grants, and we definitely have a lot more coming forward, trans everything, trans healthcare, gender marker recognition, other legalities that are trans. So that is just a bit more about it.
Thank you so much. Thank you for being here, Raven, and thank you for sharing about that experience. So now we go into the Q&A, and Timothy, if we can just get back to screen. Timothy, I think, right. Mike, right. Okay, so for the format for the Q&A, just ask persons if they can raise their hands and or put questions in the chat. And we already have in the chat from Caleb. Greetings, Caleb, and good to see you here. A very important question, which was not, how would this work in the reality in the absence of legal protections? And what Caleb refers to the experience of many transgender, whether formal or informal health policy exclusion in the region. And where does this, how did you factor in this absence of the kind of the discriminatory legal framework that exists in the Caribbean into your work? All right.
So, I would just say, and I think we could really use our public health colleagues here because they are experts in this area of translational research and links to policy. Although certainly Dr. Gromer has also done quite a bit of policy work in her postgraduate study. But I think that is an ongoing challenge in the region, right? That's one aspect of it, how you take research findings and actually, use them to influence policy in a productive way. And there's quite a bit of work to do.
I would also say in practice, when you start without legal protections, providing quality care, getting the CMEs out, and I do think that legislation will follow with appropriate advocacy, and hopefully research can be a part of that as well, just documenting the needs. But yeah, I suppose to answer that question, you're right, it is extra legal. We are operating in a situation where transgender people don't have adequate protection and equal rights.
Right, when the state does not recognize that transgender exists.
Yeah.
Right, so what do you do? Okay, so Raven, you had your hand up. Raven, and then Caleb.
Right. So my response to that is yes, there's not any legal protection. However, based on the interactions that I've had with the Ministry of Health and other legal members of the Barbados Bar Association, it makes sense to go the route of having the work with universities done in published medical journals. Because what was said to me is that transgender people do not exist in Barbados specifically, so they're not going to bring any drugs to help with the medical transition. If you're experiencing some other form of mental illness or another mental health issue that is associated with possibly the transitional phase, they're not going to have that medication readily available because trans don't exist. You don't have to have this type of medication for you to help treat it. We'll give you a generic something, maybe lorazepam, that will help. There's nothing trans specific. So the road that we took with this approach to the project was to go through the university that the research that is published in collaboration with ACSO on the ground, and then take that research, the cumulative findings to the government and state health, so that people do not exist within the marginalized subset of people, disabled, women and girls.
Raven, you're breaking up a bit, unfortunately. Yeah.
Sorry. What was it after you heard me clearly?
I think we heard you talk. Hi, Raven. Right. Just to confirm, you said that that what y'all did is in going through the university, and that you included the Barbados Bar Association in framing the legal context.
Right.
Right. Is that correct? Yeah.
Yeah.
Okay. All right.
So that the government said they will not represent because something on paper.
Sorry, Raven, we're really not hearing you now. We're not hearing you at all, Raven. Could we come back to you in a minute if you find a space?
Sorry, are you back now?
We hear you much better now, yes.
Right, sorry. So what I was saying is that the government said they do not recognize trans people because there's nothing on paper saying we need health care. So we go findings of the research project after to government, to the Ministry of Health, and say, well, now you have concrete proof that these people exist. There is the medical side looking to work with us on our needs, and then go forward to the Solicitor General to have these policies that will be adapted into health, translated into legislation, so that then we could have the legal framework to assist with the framing of the medical policies that are inevitable.
Okay, thank you. All right, thanks for that, Raven. Very important to talk, and especially this whole thing. This is very much connected to the Transgender Day of Visibility. The fact that the state says, oh no, we don't exist. So recognize Caleb and then Candace. Caleb?
As I listen to the research, I make the basic point that your research addresses the issue of structural bias and systemic bias, which exists within the context of systemic violence and structural violence, and offers a solution for the population and a way forward. I would encourage you, considering the conservative nature of regional bodies to socialize your findings, especially within the context of CARICOM, PANCAP, and to try and socialize your findings within the context of national medical associations as well. And I say this because your work is foundational and it offers awakening of medical culture at the national level, and so that exchange has a valuable social, institutional, political basis for socializing. Granted, the region it will be another 10, 15 years before the region acknowledges in legislation the gender marker of trans people. But at least we know that people like Candice have started the process by litigating for at least the acknowledgement of their existence. For me, your findings have such deep political and legal reform interventions that I'm part excited and also part pragmatic in knowing that our people in the region are still weak about understanding the value of legal reform, finding the resources to push the reform, and ensuring that we have strong redress mechanisms at the national level. We're still struggling with those things, but at least you offer one opportunity for pushing the conversation forward using a different narrative, which is health.
Thank you, Caleb. Would the panel like to respond to the comments so far? Because what Raven and connected and what Gabe, that your research is happening within a very deep social context, you know.
I would just add that one of the things that struck us is how enthusiastic our colleagues were to participate, particularly in the focus groups. And that says something really about, because they could have easily said, well, we're busy, we have clinical commitments, and I suppose they might like us personally and would want to support our research, but I think it goes beyond that, because the focus groups went on a little bit longer than we anticipated. And I don't know if we indicated on the slide, but Ariane, it was the vast majority of our clinical clerkship coordinators that agreed to participate. So it also was a very, it was an enthusiastic and broad sample of our colleagues.
Yeah.
Yes, I'm Mike, and I just wanted to add before we go on to candidacy is to also, I think now, particularly for medical students and the kind of international approach to medicine, I think, 50, 75 years ago, it was kind of get a wrangle on health, get a wrangle on infectious disease, and then that moved over to non-communicable disease. Obviously, we're now seeing a renaissance of that with the NCDs and COVID. But I think the theme for this generation of medical practitioners is really for change and be advocates for the underserved population. We're seeing a lot of, advocacy for minority groups with respect to, people of color and getting into gender reform. And so I think this generation in particular is eager to be, to take up the mantle of the fight for medicine and healthcare as a fight for diversity and as a fight for utilizing and recognizing within healthcare that we are not just providers, we're not just writing prescriptions and healing, but we are changing the world through whatever focus we are in, which is health. So I'm really excited that the theme for this kind of generation of practitioners is change, advocacy, civil rights, in a sense where medicine, in my opinion, kind of lagged a little bit because we were trying to figure out TB and syphilis. So I'm very happy for that. And so I think the two themes are merging well, and I'm hoping that translates to less than 10 to 15 years, but I'm also a pragmatist as well.
Can I add a single sentence? And that is, your research really exists within a broader discussion around economic inclusion and livelihood discussion that is taking place globally. And it adds one more layer of what we need to consider. So thank you for that.
Right. Thanks, Ariane and Kayla. Very, very important points, and the issues of hope within the current medical students. And I think you referred to the CME program for the existing, and then Dr. McCrae from Guyana, who's in the chat, also referred to the need for CME, and Caleb's point about the local medical council councils and local medical associations having to deal with that. So because also we will have within our policy framing some of the older generation. So we have to work on this. While we're working on the hopeful younger generation, we also have to work on the older generation of doctors and so who govern policy and budgets and so on. So this is going to be very interesting. Candace, Candace?
Hi, Vidya. Thanks again. So, even though that we do research and even though that we sometimes being a part of this document, it's likely or possible it should have a twofold approach. So even though that when we done the research, we come back and we said this is the finding from the research, there should be a part of implementing something to make it trial run. In terms like we were a part of the draft blueprint document, which was developed by PAHO for trans in terms of speaking about comprehensive health care, but nothing came out of those documents. So for me, I'm optimistic as my colleagues would have said that you see all these studies has been going on, but you need to see move from just study, the implementing part, working with civil society organization to see the narrative. Studies are just studies as said, work on the analysis, but the implementing, is it shifting any policy changes? Is it like, for instance, we find ways in terms of working, for instance, when we started doing this work and the response, we were working with HIV, doing HIV work, and they weren't on the form to actually document trans person. We were actually counted on the MSM. And because we were able to do the HIV work, we were able to raise it with our national HIV program, and then we were able to see data reflecting and collecting information from trans. So sometimes when we just get this research, is to see another layer of it, to see how best that it can work. And not just that the research just present to us, but then it has not worked, so it doesn't have no benefit.
Thanks for that, Candace. And acknowledging, of course, that ironically for some of the states, it's only perhaps in the HIV field that transgender citizens might have been acknowledged, but outside of that, there wasn't. And of course, Candace's work, Ghana Trans United, the work they did in challenging Ghana's cross-dressing laws, that decade of the work, the endurance they had to go through to challenge our constitution, that brought the recognition at that level that transgender citizens exist, but still not existing because the national registration and so would not acknowledge it. So that is the kind of context we're working in. So just open any more questions or comments or thoughts. I wonder, Dr. McCrory, if you're still on, if you wanted to speak about how would the medical profession, would they turn up to a CME to deal with transgender health in the context, as Dr. Harvey said, of COVID and all these, all these other dominant health concerns? I don't know, Dr. McCrory, if you would mind, do you want to speak a little bit more to that?
Yes, good morning
Thank you.
again.
Good morning.
Very briefly, I think that there's still reluctance to openly engage in these exchanges, even among us who are medical professionals. And the more comfortable we become with addressing and recognizing and acknowledging and looking for practical solutions, the better the environment in which we can actually create the necessary support for these individuals so that they will be integrated and accepted and comfortable just like everybody else. The younger doctors look up to the older us for examples. So if we are not interested or aware or prepared to address these issues, it will leave a vacuum where everybody tries their best to the best of their understanding or level of comfort. So it's very important to create that level of communication. I think at the entire level of the Caribbean, exchanging information and experience and allowing each other to, to be more comfortable with looking at solutions, even if they are outside of what we did in the past, like thinking out of the box and trying to maintain a balance between other needs of the society. Remember, in the Caribbean, religion still has a big say. Why I'm saying that in terms of being successfully able to pass legislation that would be meaningful and useful, we have to consider the sensibilities of parts of our population. So formulating those policies have to be acceptable, but also important enough to still make a difference. So we are not going at war with people who are still unprepared or uninformed to accept or fearful of accepting our discoveries and our studies and the reality on the ground. But we are trying to find a way to work together so that the society becomes more aware and more alert and more prepared to accept each and every one of us for our uniqueness and our values that we contribute to it.
Thank you very much, Dr. McCurry. Dr. Harvey, you wanted to respond?
I just wanted to respond by endorsing both Candace's and Dr. McCrae's comments. I think for me, one of the reasons I love internal medicine is because it is, healthcare is the great kind of, it's the humbling thing. We've seen it in COVID. COVID has taken on rich people, people who would normally do well in, are the protected classes, etc. And I think and I say just even, but advocacy in small ways and big ways. I think advocacy in big ways is extremely important, but advocacy in small ways, just by, changing the culture in a specialty or in an area where there's an equalizing effect somewhat. I know medicine is not completely equal, but in an equalizing effect where we have the evidence that we can say, okay, transgender people matter, they have health issues that matter, and we need to teach the people who take care of them that they matter, and this is important. If we start to, inculcate that culture, it will spread. It has to spread because they are here. We are here and it's not going away. And as we see, particularly, I think the kind of two-pronged approach, the way you get some movement through HIV, we will get some movement through all health strata because there are transgender people with all kinds of health issues. And there are transgender medical people who will become transgender physicians and healthcare providers. So it is coming. And so I think this is a really good jump off point to take the research, to get that advocacy out there, to support the advocacy with evidence, because we're in a time where fake news, not fake news, etc. We need to have those facts that, the groundwork is being put in with research and building on research, and then letting that culture change, and it will change over time. So I think this is a really advantageous time. I agree, we have to have patience and we need to be pragmatic, but I just wanted to endorse both the statements previously said that, utilizing a practical forum to be able to forward advocacy with a background of evidence that we have now is the way to go, in my opinion. So that's it.
And I think what I also heard there too is that very often people don't know and they have assumptions about populations who they only see, because all of this, all that what Caleb talks about, that when in our public health system, for example, we only have 10 minutes per patient dealing with what is presenting. And we're not dealing with all of those things that Caleb and Candace talked about the environmental conditions and so on. Then there is, I think, from what I hear from Dr. McCurry, perhaps in thinking out of the box, education also has to be some sort, that CME lecture, there probably has to be some sort of format for dialogue. I think what Butterfly Trans Barbados, in partnering with UE, with the establishment, that is really important, and a lesson in terms of how the vulnerable populations are active participants in the research as well. So it's not just being done. So there's an active participation. We hear that. And in leading how that research is presented to the establishment. And I think that is something that is certainly interesting that I heard. And I hope that we can build on that in the region to talk about that as well. You know, how do you bring the academia and the professional associations in contact with them, you know? So, so thanks very much to everyone. If there are no other questions. Yes, hi,
Sorry.
yeah. Alexis DeMarco, yeah, sure, go
Yes.
ahead. Please go ahead, yes.
Good. Alexis DeMarco here from UC Trans, the regional network for trans citizens living in the Caribbean region. I've listened to the presentation, I've listened to all the comments, and I welcome the report. Very well done. I want to echo the sentiments of my trans citizens and colleagues as it relates nothing for us without us. And you just mentioned the point, ensuring that they're a part of the dialogue, ensuring that they're talking to the medical doctors with you, it's sharing their own personal experiences and their barriers in accessing healthcare. We are tired of self-medicating. Healthcare is not an option for us. Healthcare is our right. And I think speaking that language to decision makers, to gatekeepers, to medical professions, having them have their voice in these forums will help push this agenda. Again, the Caribbean region is very sensitive. As the good doctor said, other religion plays a whole factor into the way we dialogue and the way we have persons who distract the conversation. But for us, again, we have to use the same principles. We have to use the SDGs. We have to speak the jargon of decision makers and gatekeepers that healthcare is not an option. Trans citizens do exist and their visibility is important. And this will help push the agenda for access to healthcare for trans persons. And I just wanted to add that point.
Thank you so much for sharing that and emphasizing that, Alexis. Something that occurred to me too when you were presenting the slide about the levels of professionals that you're going to go to the ambulance drivers and the paramedics. I know from colleagues in Guyana that you also have to talk to the security guards at the hospitals and health centers. And the ancillary staff, right? That those are often the ones where the first, I'm just saying that too because I recall, but that is the kind of, the health sector is not just, it's just a full range of persons. And the discrimination is experienced in so many ways. And alternatively, the positive impact could be had from how those people interact. So I know that we're at the 1 hour mark for the conversation. And if there are no further questions, I just wondered if the panel had any closing remarks. And then I'll go to Candace for a vote of thanks.
I would like to just say one thing. In our future research, I think that needs assessment is really important. As Alexis was saying, it is really important for trans people to be involved and to be visible and to be involved in advocacy. And I would invite any of you to reach out to us in the near future, about our future projects, which I think should really include qualitative investigation of trans people in the Caribbean and what they feel their healthcare needs and experiences are and have been. So yeah, we will share our email via chat. I think that's a good idea. That's really all I have to say. Thank you all so much for attending and being engaged in this really important topic.
Well, I think I would just say thanks on behalf of our colleagues here and our colleagues who are not here for inviting us, and thanks to Raven and Butterfly Barbados for ongoing collaboration and dialogue, and we look forward to more. I think all of us have put our emails, and we don't actually have a group email, but you can reach any of us individually, and we will talk to each other. And I think that is all from us. Thanks again.
Thanks so much.
So Candace, over to you for closing thoughts and comments, Candace? I think Candace got kicked off. I'm so sorry.
Hi, Vidya. Colin here.
Oh,
from
Colin, thanks,
Trans
Colin.
United. Yes, I think they're getting some internet problem over the office there.
Sure, Colin.
But I'd
Okay.
like to take this opportunity to thank all those who were involved in doing the quantitative assessment, the research, helping our transgenders members and community across the Caribbean to get to that level that we all want to be free to access every service possible with equality. So I take this opportunity to thank the team at PANCAP also, Timothy, and those who have been instrumental in facilitating this session. And I thank those who have been a part of it, taking time out to sit in, share their little views in whatever way necessary. So I take this opportunity to say thank you once again and to extend a happy Day of Visuality tomorrow to our transgender community. So with this, I say thanks from behalf of Guyana Trans United. Thank you. Thank you.
And Timothy, Timothy, have your hand up?
Yes, Vidya, just to say on behalf of all the organizers, both at the GTU and PANCAP, to say thank you to you. You're an excellent moderator this morning. Thank you so much for the excellent job you did. And thanks to Dr. Mike and his entire team. Before you close, Vidya, could I just ask if you can just ask everyone to turn on their cameras and if we can just get a group shot of if you can turn your cameras on, that would be excellent for us. We just want to get a shot of everybody who was here. We really appreciate your attendance. We just want to get a group shot to remember this.
Thank you. So we're going to do the group shot.
I don't have a camera at my desktop.
Okay, right. For those who can turn on their cameras, who are still present, thank you.
Okay, can we get some big smiles, please? Some very big smiles. Just a moment. Thank you so much. That was excellent. Thanks, everyone. Thank you.
All right, so thank you, everyone, and with wishes to wellness. Please continue, and please remember tomorrow and always the transgender citizens. For those of you who have never had an engagement, perhaps reach out to the associations in your countries to engage. And there are many transgender activists. We encourage to have that dialogue. Don't wait on anyone else to arrange that. So thank you very much to everyone. Right.
Thank you, Vidya.
Right. Bye, Colin. Thanks.
Bye.
Bye.
All right.